thanks for tuning in to Pregnancy Pearls with me, Dr. Plenty. Welcome back. It's been so long since I've done a video. It's been about 3 weeks, but I promise I'm going to try to do these videos a little bit more regularly. So today, what we're going to talk about is your questions. Several people have emailed me questions over the past couple of weeks. If you follow the podcast or the YouTube channel, you know that some questions I talk about on the podcast, and some questions I just reply back to immediately. But it's been brought to my attention that some of these answers everybody should be able to hear to gain a little bit more insight. So I have tried to keep a compiled list of questions, and I will answer as many questions as I can get through in the next 10 minutes or so. These are questions that I have replied to already, so don't think I'm just sitting on questions for 3 weeks, because that's not right. But these are some of the questions that I've gotten in the last couple of weeks, so I'm going to answer them on the air. But before we get to the questions, please click the subscribe button below. Make sure you're sharing this information with a friend, and make sure to subscribe to the Pregnancy Pearls podcast. Stay tuned. All right, so let's get into your questions. So the first question is pretty straightforward. It says, Dr. Plenty, is it safe to take pain medicine in pregnancy? Yes and no. So let's start with the no. If you're over 32 weeks and that pain medicine is Motrin or ibuprofen or any other non-steroidal anti-inflammatory, then the answer is no. NSAIDs, or non-steroidal anti-inflammatories, can cause there to be some issues with the baby's heart. It can close one of the shunts in the baby's heart prematurely, so we don't want that to happen. So if you're taking NSAIDs, then you should not take them, especially after the 32nd week. However, if you're prescribed a pain medicine for chronic back pain, things like Percocet or Norco, those can be okay. I would still use those in moderation because they can cross the placenta. Some babies that are born to moms that are on opioids, which is what Norco, Percocet, Tylenol number 3, if you take those for long periods of time, it can have babies have failure to thrive, so they come out very sleepy, they can be very floppy, and they can have issues with breathing. Taking it sparingly is okay if you've been prescribed that for a chronic condition. So talk to your OBGYN, maternal fetal medicine doctor, or pain specialist, or whoever prescribed you that, to make sure they know that you're pregnant and to see if you're on the best regimen that's safest. Now, before the 32nd week, yes, some doctors will prescribe a short course of pain medicine if patients have issues with preterm labor, if they have issues with pelvic pain. They'll be prescribed, they may be given a dose of Toradol, they may be given a dose of Motrin on a very short course. That's okay. That would not be causing any long-term effects. Sometimes if you have had a procedure in your pregnancy, like you had your gallbladder removed, or you've had a cerclage, which is a vaginal procedure to keep the cervix closed. Remember, cervix is the opening of your uterus, to keep that closed to prevent you from having preterm labor. Some doctors will prescribe a short course of pain medicine just because of post-surgical pain that's anticipated. And then some doctors will also prescribe a short dose of course of Indocin. Indocin is an NSAID, but it also is helpful for preventing contractions. So that's a pain medicine, and that is okay if you've been prescribed that in a short course. But if there are specific questions you have about certain pain medicine, shoot that question back to me, and also talk to your provider and make sure they know that you're on these medicines, especially if they weren't the ones prescribing it. Also, all doctors are not going to assume that you're pregnant. So if you're seeing a rheumatologist or a hematologist for another chronic issue and you haven't said, hey, I'm 8 weeks or 10 weeks or 12 weeks pregnant, they are not going to know that. So make sure when you go to a provider outside of your OBGYN or whoever the your obstetrical provider is, make sure they know that you're pregnant, and ask them if the medicines that you're on, even if they're just continuing medicines, are safe in pregnancy. That's really, really important. Don't ever assume that, even if it's in the same system, don't assume that your hematologist can see your obstetric chart, or your nephrologist knows that you're pregnant. They may not know that. So always give too much information versus not giving enough. Okay, next question. And it reads, I'm 22 weeks pregnant with my first child and have my second genital herpes outbreak. My OBGYN called in a prescription for Valtrex. Is my baby at risk for getting infected? So luckily, your OBGYN is doing the right thing, and that is treating you with Valtrex. Valtrex and acyclovir are first-line treatments for genital herpes. And as long as you're treated and you don't have any lesions at the time of delivery, then the likelihood of your baby getting a congenital infection is very, very slim. However, if you have lesions in the vagina or on your thigh, then yes, your baby can get exposed if you're having a vaginal delivery. So if you have lesions or you feel something in the vagina, please let your provider know. This is not the time to say, I don't want a C-section, because congenital herpes is a real thing. Like your kid can have encephalitis from herpes. So you don't want that to happen. So if you feel funny, most people that have herpes may feel pain from the lesion. They may feel itching before a lesion actually develops, or you may see a lesion. Also, sex would be painful because the lesion, rubbing against that lesion can be very painful. If you're having those symptoms, don't have sex. And also make sure that your OBGYN knows so they can do a speculum exam. Speculum meaning that little silver thing that they insert into the vagina when you have a pap smear. That way they look around inside of the vagina and to make sure that there's no lesions there so that your baby will not be at risk for contracting the herpes virus, the herpes simplex virus, which can cause some bad things to happen. So right now you're doing the right thing and you would not be at risk. But if you don't treat the course or you feel like you're having another outbreak, then always make sure that your provider knows so that they can treat you again and or so they can culture the lesion to make sure that nothing else is going on. And this is really just an HSV or herpes lesion and not anything else. The next question. I previously used Proactive for acne, but stopped using it when my husband and I started trying to conceive. Now I'm 16 weeks pregnant and my acne is horrible. Is Proactive safe to use in pregnancy? So acne in pregnancy is a real thing. I mean, the skin changes because you have all of these hormones that are raging now. So if you're just having acne, yes, Proactive is pretty safe in pregnancy. Benzoyl peroxide is the main ingredients, as well as salicylic acid. Both of those topically are completely safe in pregnancy. What you want to avoid is anything with retinoic acid. Retinoic acid is a no-no in pregnancy. It can cause some major birth defects in the baby, and those on retinoic acid before pregnancy should have a negative pregnancy test for at least 2 months before trying to conceive. They should be off of their medicine for at least 2 months with a negative pregnancy test before trying to conceive, because it's that serious and can cause you to have some severe, your baby to have some severe deficits. So yes, Proactive is okay, but anything with retinoic acid is not okay. Okay, the fourth one. Oh, and by the way, we will be having one of my friends who's a dermatologist will be on in January on the podcast to talk more about acne and skin changes in pregnancy. So I'll make sure everybody knows about that episode well before it airs. The fourth question, Dr. Plenty, I had preeclampsia with my last pregnancy and delivered at 34 weeks. I am now 18 weeks pregnant. Am I at risk for developing it again in pregnancy? Yes, you are at risk. Anytime we've had preeclampsia in a previous pregnancy, you are at risk for having it again in a subsequent pregnancy, and you're more likely to develop it earlier than you did the last time. So if you had preeclampsia at 37 weeks the last time, you're more likely to develop it even earlier. The average gestational age for diagnosis of preeclampsia is somewhere between 29 and 31 weeks. Some people obviously get it later, some people get it earlier. So to prevent you from having preeclampsia, you can't really 100% prevent it, but you can do things to reduce your risk. So you're already 18 weeks. Hopefully your OBGYN has already started you on aspirin for preeclampsia risk reduction. It's just one baby aspirin, 81 milligrams taken once a day, all the way through the pregnancy into about the 36th week. That will help reduce your risk of pregnancy if you start it now. Now, you should ask, if you're not on it, you should ask your OBGYN, why am I not on this? And I say that because some people that had issues with bleeding early in the pregnancy, that's why they're not on it. And if you have a bleeding disorder, you may not be put on low dose aspirin. However, if you don't have any issues with bleeding, then you should be on it. So I would send my OBGYN a message, because sometimes we're not perfect, guys. Sometimes we just forget. It may slip our minds. So ask your OBGYN, hey, am I supposed to be on aspirin? I was watching Pregnancy Pearls with Dr. Plenty, and they mentioned aspirin will reduce my risk of preeclampsia this time. Is it okay for me to take it? And I always say, always involve your OBGYN so they can know what's going on, or your provider if you're going to a nurse practitioner or a midwife, so they can know exactly what you're on, so they can document this in your record, because you don't want to exclude them and just take my advice. I love y'all, but you need to let your actual providers know as well. And 9 times out of 10, they'll say, oh my God, I completely forgot about that. Other people who should be on aspirin for preeclampsia risk reduction, even if you are not, did not have a previous pregnancy, if you are basically me, I am overweight, my BMI is 27, I am African American. If you have that, if you are like me, you should be on aspirin, because being African American and being overweight, those are 2 risk factors. Even if I was skinny, the fact that I'm over age 35 is also a risk factor. So if you have 2 or more moderate risk factors, then you definitely should be on aspirin for preeclampsia risk reduction. Okay. Also, if you are basically any minority, you should be on aspirin. If you also had a history, like we said before, preeclampsia, or have any autoimmune disorders, so you have thyroid disease, Sjogren's, lupus, you should be on aspirin for preeclampsia risk reduction, because you have a higher risk of getting preeclampsia. And let's not forget about our diabetics. They definitely have a higher risk of preeclampsia. Diabetes alone, you need to be on aspirin for preeclampsia risk reduction. Also, there is I believe episode maybe 4 or 5 of the Pregnancy Pros podcast was on preeclampsia. So go listen to that episode. And then one of my first YouTube videos was also on preeclampsia. So go check those out, because they're pretty good. So check them out. If you have other questions, just let me know. All right. The next question. I'm 10 weeks pregnant, but also have an 8-month-old. Is it okay to continue breastfeeding during my pregnancy? Yes, it is okay to continue breastfeeding. The amount of oxytocin that's released when your baby is latched is very low, so it should not put you in preterm labor. There's been no studies that show an increased risk of miscarriage or anything like that if you continue to breastfeed your little one while you're pregnant with your next. However, in the 3rd trimester, if you start having issues with preterm contractions, your OBGYN will probably say, we may need to cut back on that. If you also have a history of early, extremely preterm deliveries, like 26, 27, 28 weeks, you will likely be told to no-go on the nipple stem, meaning no-go on letting the baby latch because of the release of oxytocin, because you are a significantly higher risk of going into preterm labor. But until the 3rd trimester, even into the 3rd trimester, if you don't have risk factors for preterm delivery and you're not having preterm contractions, then yeah, it's relatively safe to breastfeed, and it's actually encouraged. Now, the question is, what are you going to do when that next baby gets here? And that next baby is like, wait a minute, that's my breast. And your, 18-month-old's like, wait a minute, that's supposed to be for me. So, hopefully you will get through the first year. I mean, you're 10 weeks now. So hopefully you'll get through, the first 8 or 9 months with, breastfeeding your little one. But then it's a matter of, are you going to breastfeed both at the same time? Or are you going to have one take the bottle and one continue to breastfeed? That's completely a personal preference. And the last question, because I realize I've been talking now for over 15 minutes. How do you handle loss of a patient? Wow. Unfortunately, being a high-risk OBGYN, I do have to take care of patients that are much sicker than some of my general OBGYN or family medicine colleagues. And I handle it, I guess, like anybody else would. And usually, first, I do everything I can to prevent a patient from dying. My job is to take care of both of my patients, the mom and the baby. They're both my patients until that baby gets here. And then the mom is my patient and the baby is the pediatrician's patient. So I try to do the best I can with estimating, hey, is it the safe time to get out if somebody has preeclampsia per se, versus, do we want to prolong this pregnancy to get the baby some benefits? So I never want to lose either patient. But if I've lost either patient, then I immediately put on my hat and say, how could this have been prevented, or can it be prevented? And luckily, and I'll knock on wood, and yep. Luckily, I haven't had patients that I've followed for prolonged periods of time that I've lost. Usually it's patients that come in that had no prenatal care. I'm consulted on them for the very first time and they're in the unit and they're already doing very, very poorly, that I lose patients. It doesn't mean that I don't feel, the loss, just as much, just because I hadn't followed them for a prolonged period of time. But it's, for me, it's trying to comb through everything to see what could have been done this pregnancy, so that another pregnancy won't happen. Like, I won't lose another pregnancy. And then I talk to the family. I'm very open about what's been done, what hasn't been done, and why we made decisions that we made. And I think that it's always best to be very honest with patients when there are things that are going on. I think it's also very pertinent to communicate with the rest of the family while you're doing the things that you're doing to try to keep both patients alive. And whenever I lose one of those patients, then I sit with the family. I answer whatever questions I have. Sometimes I cry with family members. It's, hard. But as a high-risk specialist, that's sometimes I have to do that, more so than my OBGYN colleagues. And it's hard. And at the end of the day, I go home. I pray. I pray for that patient's family. And I pray that God gives me the strength to move forward and the insight to know how to prevent this from happening again in the future. Well, sorry to end on such a low note, but I think it's good to wrap up. If you guys have any questions that you want to ask, I'll do these Ask a Doctor sessions every once in a while. If you have questions that you want, please email me at pregnancypearls@gmail.com. Or you can always send me a direct message on Instagram at pregnancy_pearls, or through Facebook, which is just at pregnancypearls. Or you can drop a comment in the YouTube comments below. So make sure to subscribe, share with friends. Thank you guys so much for listening. I am so grateful for all the friends of the podcast, for all of my YouTube family. Thank you guys for all the support since I started this whole Pregnancy Pearls journey earlier this year. I've been so supported. So I hope you guys had a fantastic Thanksgiving yesterday. And yeah, until next time, bye, and hope to see you guys soon on social media.